Welcome to the PTCB 2026 Infection Control Mastery video. We will focus on infection prevention and cleaning standards, including procedures, personal protective equipment, and equipment. This video provides comprehensive exam prep, tips, traps, and knowledge for certification success. Hand hygiene is critical. Rings increase microbial load. Natural nails should be less than a quarter inch without chips. Use warm, not hot water to prevent dermatitis. Always perform hand hygiene before donning new PPE. If your gloves tear, perform hand hygiene before putting on new ones. Use soap and water when hands are visibly soiled after the restroom, or if organic debris is present. Use alcohol-based rub after glove removal or between vial entries. Both require a 20-second rub. Remember, alcohol is inactivated by organic debris, so wipe first, then sanitize if needed. The correct donning sequence is hand hygiene, gown, mask, goggles, then gloves last. The doffing sequence is gloves first, then hand hygiene, gown, hand hygiene, goggles, hand hygiene, and mask last. The outside-only rule applies to touching contaminated surfaces. Remember, the mnemonic, gloves are gross, go home, for the correct doffing order. For chemotherapy and hazardous drug handling, USP less than 800 greater than requires ASTM D6978 tested chemo-resistant gloves. Double gloving and no powder are essential. Nitrile is recommended for non-chemo hazardous drugs. Avoid latex. Change gloves every 30 minutes or immediately if torn. N95 respirators require a seal check, and facial hair breaks the seal. A surgical mask is sufficient for a sterile prep hood. Always remove masks by the ear loops only, as the front is considered contaminated. If a gloved hand adjusts the mask, discard gloves, perform hand hygiene, and don new gloves. Daily or after each use, clean counting trays by dumping residue, wiping with 70% IPA, and air drying for 30 seconds. Weekly, remove to the sink, wash with warm soap, rinse, wipe with 70% IPA, and allow to completely dry. Avoid acetone, as it damages acrylic surfaces. Always document initials and date on the cleaning log. For cleaning penicillin dust, first wipe with water to dissolve the powder, then wipe with 70% IPA to disinfect. This prevents airborne beta-lactam. Best practice is to use separate trays for penicillins. Counting warfarin after penicillin with the same tray is unacceptable due to the high risk of cross-contamination. For metal spatulas, wash and dry. Wipe with 70% IPA and store in a labeled clean cup. Never pocket a spatula, as pockets contain lint and microbes. Plastic tweezers are preferred for single patient use. Reusable plastic tweezers follow the same cleaning process as trays. If a dirty spatula is put in a drawer, remove it, clean it, and document the action. Shift cleaning procedures begin by removing clutter, applying an EPA-registered disinfectant, and allowing full contact time. High-touch areas like keyboards and mice are focus areas. For visible dust, you need a cleaner first, then IPA. IPA is ineffective against spores and requires pre-cleaning. ISO 5 hood cleaning is required at the start of the day, every 30 minutes of continuous use, and after a spill. Use sterile 70% IPA and a lint-free pad. Wipe side to back to side using overlapping strokes to prevent recontamination. Do not store labels or pens inside the hood. For floors and carts, dust mop, then wet mop daily with disinfectant. Avoid spray bottles. Carts must be stainless steel with no cloth covers. Trash should be removed at least daily by garbed staff. Maintain temperature below 20 degrees Celsius and humidity below 60% to prevent mold. For pill counters, after each run, empty the chute, use a hand vac, and IPA wipe the sensors. Weekly, remove the back plate and swab with moist IPA cotton, drying for 5 minutes. Monthly, calibrate and log it. A critical rule is never to submerge electronics. Cleaning involves disassembling, cleaning with warm water and mild detergent, a final rinse with water for injection, and air drying on a lint-free tray. The part must be fully dry before sanitizing with 70% IPA. Sterilization is completed with 1 hour of UV light in the hood. Log serial numbers for traceability. Delay sanitization until fully dry to prevent IPA dilution. Essential records for every count include lot number, NDC, expiration date, quantity, and technician initials. Retain batch records for 1 year post-expiry. In a recall scenario, the first action is to retrieve the log to identify the impact. The second action is to notify the pharmacist to initiate the protocol. Prioritize actions addressing patient safety and traceability. Exam strategy tips include spotting recycled distractors, like skipping hand hygiene or using the wrong disinfectant. Flag absolute words like only or never in question stems. Use the 30-second rule for cleaning needs. IPA wipes need 30 seconds to dry. For cross-contamination prevention, thoroughly clean the counting tray and spatula after counting penicillin. If a beard prevents a proper N95 seal, use a loose-fitting powered air-purifying respirator. For a spill inside the hood, stop activity, contain the spill, sanitize the area for 30 minutes, and document the incident. Review this high-frequency rapid recall list to self-test your knowledge. Key points include washing hands for at least 20 seconds, using 70% IPA, and proper donning and doffing sequences. Use this list to test yourself daily until you achieve 100% twice.